utilize resources like the Global Health Curriculum and PIH Engage Crash Course. Here's a look at all of our PIH Engage teams across the U.S. We plan and host fundraising events and campaigns to support PIH's work to prevent senseless deaths and deliver high-quality healthcare in some of the world's poorest places. We fundraise from a social justice framework, utilizing personal outreach to build relationships and radically reimagine how wealth and healthcare access are understood. Each team works to set their own fundraising goals. PIH Engage members reach out to new contacts and invite friends and family to contribute to PIH's work to provide healthcare to the most vulnerable. Ordinary people who band together to form social movements, also known as grassroots organizing, are a key source for the recognition of human rights by governments. Draw inspiration from social movements like the Civil Rights Movement and ACT UP and the AIDS movement for access to medicines. We learn from their tactics and strategies and use them in the movement for global health equity. So how do we ensure that health is recognized as an essential human right in the United States and around the world? Through a social movement.
I think all of you are at PIH engaged because you believe in health as a human right and you believe in health as justice. Understand is fundamentally retrospective. We look backwards and say, where was injustice done? How do we make it right? And I believe in the 21st century, the way we make that right is that assuring that everyone on the planet, including Americans, including people in Rwanda, Lesotho, Malawi, Liberia, Sierra Leone, Haiti, Mexico, Peru, Kazakhstan, Navajo, Rosebud, that everyone has a right to healthcare. One of the main things we're working on at PIH is universal health coverage. Why? Because health is a human right, and because we need structures that will deliver care, health systems that have the adequate staff, enough supplies, decent and dignified infrastructure, and the right social supports for the poor. And we know right here in the US, we don't have that.
Together, we can push forward the movement for the right to health. Learn more.
Okay, that is pretty much the gist of what. Okay, so that's like the gist of like what Engage is and how we're like each little college chapter and how it's structured. So we have our team leads and team coordinator, and then we have a coach. And it's PIH is a really cool organization overall. They're doing a lot of really cool stuff, and we get to like. We work with them on their big campaigns. So every year we do a fundraising campaign, and every year, based on like whatever advocacy is coming up, we'll like help with them. So this summer we did a bunch of work with like COVID bills and stuff, and then we'll see like what happens next with vaccines and stuff. But we'll help support whatever PIH is pushing through as well. So that is a little overview of like what our organization is and who we work with.
And then this is just kind of a history of our chapter. So there used to be one, I don't know when, but I think it kind of died off, but just got restarted in July of 2020, so not that long ago. And then they had several advocacy meetings during the summer. And then the founders of PIH had like a big Zoom call, which was just a Q&A to ask them about what things are going on right now in PIH and how they got started. So we attended that. And then we had a fundraising campaign going on, and we already reached our goal, which we way overshot it, which is really awesome. And we'll talk more about this fundraising. It's always ongoing, so we'll talk more about that. And then we hosted our own Bending the Arc, like watch party. And that is like the documentary about how PIH got started. And it was really cool. It's also on Netflix if anyone hasn't seen it and wants to check it out. And then us as leads, we have attended several network-wide events. So our team lead or / president is Julie. Community building and education is Alexis, and they're both not here now. And then Katie and I are for fundraising. And then we're starting something new for our meetings this semester and then for all future semesters, but we're gonna do like PIH updates, which is just about stories about the national organization, just to give us an idea of what's going on there and so we can learn more about them. But we'll just do like a news story each week so we can learn more. And if you want to see other ones, they have a news tab on their website, and they're all focused on like individuals So healthcare workers or like patients that they worked with, because they're a lot about partnering with people in the community. They're really focused on getting to know every person. And then you can also learn more by following them on their Instagram. So they do a lot of spotlights, fundraising updates, and they have like factual information. I like to put some of those like on my Instagram stories so that other people can learn more. And then they have like educational events, like they'll send out information about like the Q&A, things like that. So for this week's story, it's about mothers caring for mothers, delivering maternal care in Chiapas, Mexico. So this one is about a community health care worker named Vilga Vasquez, and she works for PIH. And these community healthcare workers are trained by Partners in Health, and they do a lot of like home visits, and they learn a lot of basic care. And she said in this article, she said home visits are important because sometimes it's difficult for patients to travel to clinics, which can be far from their homes. So they're really important to bring healthcare to people who otherwise won't be able to get it. And then they've taken on many safety precautions for the pandemic, including reducing visits and then PPE. And that's become really important, you know, during this pandemic because people, again, who can't get healthcare easily are even more at risk and at a disadvantage. And then another quote, she said, "What I like most about my job is learning and helping. I'm learning that we have to take care of our bodies, help people, and build a support network among ourselves," which I think is really inspiring because I personally love public health because of that support network and helping people. So, yeah. And then the actual article is on the website if you want to check it out. And then that's her. And there's Chiapas, Mexico. Very tippy bottom.
All right. And so now I'm just gonna talk a little bit about our fundraising campaign that Partners in Health is doing, and as Engage, we are also participating in. But basically, this semester or last semester and this semester, like as an Engage network, as like all of our college students across the U.S., we have been working to raise money to build a new maternal center of excellence in Sierra Leone. And this is an area that Partners in Health has identified that they want to help with because in Sierra Leone, they have like the worst rates of maternal mortality in the whole world. And it's just simply because they don't have access to a good hospital. They don't have electricity. They don't have blood available. And like women just die at like staggering rates in childbirth. I think it's every 1 in 17 women will die in childbirth or something like that. So our network goal, like as a team of Partners in Health, Engage, all the college chapters, is to raise $100,000 by April of this year. And hope we're like pretty close to that goal already, which is super cool. And it's been really fun to like get to fundraise with people all over the country doing that. And then this is just another link to some more information about Sierra Leone and like why Partners Health is targeting this area and like why as an Engaged network we're targeting this area. So yeah, basically really high rates of maternal death and just for very preventable reasons and just overall, again, stemming from injustices from years and years ago in Sierra Leone. And that's again, like Partners Health whole mission is to use social justice and solidarity to like make up for systemic issues in these countries. So yeah, and this is like their plan. They have a plan to build this new maternal center of excellence, and all of the money we're raising is going to help fund that, which is super cool. So like everything we're doing is helping to build this new hospital and going to help save a lot of lives and have a lot of healthy moms and babies. So this is just more information. We'll send this out in the email too, but this is kind of like an overview of like why we're doing this. And yeah, are some of their goals to hopefully by 2025 to help improve coverage of care. And this is like a graphic that we use during our fundraising. I've been posting like on our Instagram stories or something, and just kind of like highlights a lot of the bad about a lot of the issues happening in Sierra Leone, and the Maternal Center of Excellence will hopefully help to combat these. And Partisan Health has been already like working in Sierra Leone, and already things have been improving a little bit. So with this new hospital that we're going to help fund, things can keep getting better. All right, and then, okay, so if anyone here is new today and you want to start getting involved a little bit, one thing you can do is set up a personal fundraising page, and I'll put this link in the chat, I think, because this is how you like set up so if anyone you've done Buckeye-thon or anything like that, oh, that's my information too. Okay, I'll copy this link, and if it copies my information, just take it out. Didn't know that would happen. Okay, where's the chat? So if anybody here today is new and you just want to like click on that link and start your fundraising page, you can do that today too. If you don't want to start it today, it's okay. But basically, so how we're fundraising is each of us has a little fundraising page that we've been adding money to throughout the semester and throughout the school year. And it's kind of like, again, like Buckeye-thon. If any of you have done that, where you can just like send this link to your family or your friends and have people donate to it. And at the end of the year, it's all going to be donated to the Maternal Center of Excellence. And if this is some of the information you might need, our coach is Anna, and our team is the Ohio State University. Just make sure you type that in. And then this will also be sent out in the email tonight. Oh, shoot. But basically, if you want to learn more about PIH Engage overall, there's something called a crash course, which you can do. And basically, if you just want to click this link, and we'll send this out, but it's a crash course. It's a link to this Google Doc, and it has all these videos and information for you to like learn more about the organization. And if you want to do it or get started with it, like feel free. It's not required, but that's just a good thing to do if you want to learn more about the organization and like kind of be more well-versed in it.
This is me. Okay. Sorry. So this is just our overall fundraising update about what we've been doing. So this is our fundraising dashboard. And this is like compiled information from all of the engaged teams. Let's see here.
Sorry, I have like 1,000 tabs open. So this is my fault.
Okay, so yeah, you can kind of see. Slowly going. Or are we number 1? Okay, sorry. Didn't know that. Exciting. So it shows all the breakdown by the different teams. And then you can see on the very far left in the bottom corner, Julie and Alexis are actually the top 2 supporters, which is super awesome. They went super hard with the fundraising, which is really cool. And there's like a heat map. And then, yeah, we're almost to the total goal, which is really cool. So with the more support, yeah, there's our team with all the names.
Yeah, it's really cool because our team we've raised the most out of like all the other colleges besides the network team, which is like the adults who are in charge of Partisan Health. But like we're really far up there. We're beating like everyone, and who we're beating like all these other schools like Duke and it's just cool. It's just cool to see. And again, it's all part of like we are all in like contact as leads with all the other people of the other schools too. So it's just like a cool way to like collaborate and see and just see how everyone's working together. So we love this map. We like to refer to it a lot. Okay.
And then some of the other fundraising we've been doing, just like not for the Sierra Leone thing, but just for PIH in general, is we have a sticker sale going. So that is on Redbubble. I don't know how to get out of full screen. Sorry, I'm gonna send the link to the Redbubble in the chat. It's gonna take me a second. But this is something that you can send to your friends. A lot of them are more like, healthcare focused. So if you know anyone in, oh yeah, Katie's showing our water bottle, in public health classes or the pre-health people that would be interested in these, you can send them to them or buy them yourselves. I also have some on this one's like, it says vaccines save lives. but we have that. And then we have an apparel sale going as well. Oh gosh, I need to get the link for that too. Sorry, guys. And that is like t-shirts and sweatshirts that have the same designs as the stickers.
Yeah, I sorry, you just sent it you DM'd it to me, so I sent it to everyone.
Oh, whoops, sorry.
Yeah, all good.
Okay. I'm gonna send the apparel links in the emails because each individual like t-shirt has its own link, which is kind of annoying. But that will be sent in the emails so you can see that information. And then we have plans for a bigger event later in the semester, just to like mix it up a little bit and get more people involved as well.
Okay, so basically for this semester, our big thing is we're going to be having some sort of bigger fundraising event to be held in like February or March. But we're not totally sure what it's going to look like. We're thinking sort of virtual 5K, something done virtually and safe because we don't know how things are going. And also, I don't know, with like the centers with like student life and stuff, they still haven't told student orgs of like what we're allowed to do and like with food or anything or any type of organization at all. So we're gonna like see what we're gonna do. In a normal semester, we'd be doing like a real 5K, and PIH has this cool one called Strides for Solidarity. So we'd all like do it as a network too. And then basically, and then for advocacy, we just kind of see what happens with that. So we have opportunities to like meet with our senators and our representatives, but those kind of come up as PIH is going to like focus on a certain bill right now. Obviously, there's like not a lot of bills or pushes being gone through right now in the government, but that's a cool thing to do. Hopefully, we'll get to done that this semester. And other than that, we're just going to focus on like educating and spreading the message of Partners in Health. And that's kind of like our goals for this semester. Again, still the weird virtual semester thing, but it's still really cool and fun to learn about Partners in Health and like get to fundraise and do stuff for that. So, and there's also like network-wide events that will come up, like that founders Q&A and stuff. So that's what our semester will kind of look like. And just again, and if you want anyone else interested in like helping to plan this virtual fundraiser thing more, just reach out to me. My contact information at the end, but let us know if you want to get more involved.
All right, and then we do have an involvement fair coming up. It's actually this Thursday from 4 to 7. So obviously if you're already here, then you're interested. But if you know anyone else that might be interested, let them know, or just stop by if you have any questions you want to ask us personally that you want to get answered. And then can you go to the next one? This is a little graphic I made that you can add to like your Instagram story. I sent it out in the GroupMe, so if you need to join the GroupMe, just email us and then we can add you. But I actually put this up today and I already got someone DMing me asking questions, so it works. So yeah.
And then some of our other reminders, basically, so let us know if you need to be added to the email to GroupMe. I know I added a bunch of people today because I sent out the link in the pre-health chat, which is super cool that I got a lot of people today. And then again, if you want to learn more about Partners in Health, you can watch Bending the Arc on Netflix. I know Aya and I cried watching it, but it's a really good, really cool movie about the founders because they're super cool. I don't know how many of you guys, if you took Global Public Health at some point or like read the book. And then another thing you can do if you have spare time, which you probably don't, but to read Mountains Beyond Mountains, which some of us had to read for public health class. I know that's how Julie like got inspired for it. We all read it last semester and she was in my class, and I remember reading that book. And being like, wow, this is so cool. Love that book. But that's another good way to like learn more about the organization. And then overall, like something to keep in mind, we are still looking for an advocacy lead. So if you are interested at all in like being on our leadership board and doing like the training for Partners in Health, let us know. And then also for next year, like next school year, if anyone is like a sophomore or a junior or even a freshman and you want to like learn more about getting involved, we're going to talk about like doing some sort of elections or making the board for next year, like later March, February kind of a deal, just to like, so if you think about it. But yeah, and then ionize, our dot numbers are right there. But if anyone has any questions, you can like shout it out or like send us in the chat. But um, I don't know, and stay safe these next couple days and hope everything is going well. I don't know, Aya, do you have anything to add?
No, I don't think I have anything else.
But
But
yeah,
yeah, it was really good to see a lot of new faces. And if you have any questions, definitely feel free to ask us. We're very excited that
yes.
we're growing. Love
We
it.
love Partners in Health. But yeah, feel free to like stick. You guys are all free to go if not, like stick around and you can ask some questions. But again, like super appreciate everyone taking their time tonight to come, and we're hopefully gonna be able to plan some fun fundraisers and do some other cool events this semester. So yeah, that's all for tonight.